Hello everyone. Good morning, good morning, good morning. This is Phua from Symptom of Balance, the acupuncturist. Today our topic, we're going to cover what are the symptoms of stable angina. Angina. We talk about the cause of angina. We know that the cause of angina is because the heart has not got enough oxygen, which is blood flow, and that is caused from the arteries narrowing. The narrowing of the arteries that prevent the heart from receiving more oxygen, and that's causing angina. So now we know the cause, and that is what will cause the narrowing arteries is because not doing it very well. Sorry, it's just okay. All right, just checking. I'm not able to do a live video on my Instagram. Just checking what's going on here. No internet connection. That's funny. Right. Sorry, to give a minute. Hi, Veronica. Just reconnect our my Instagram. Checking connection. That should happen. Trouble starting there. Let me unplug and put it again. Yeah, I'm live now. Okay, that causing what happened is the causing the narrowing of the artery is from one of them is from the plaque, and what's built up and blood clots, and what built up plaque is the it can be calcium, it can be cholesterol, right? Can be fat, right? And other substances, right? Can be others. And then those things that we just mentioned, fat, cholesterol, calcium, is all from the food, what you intake. So this is important. And blood clots you can cause from cold, if you're not taking keeping warm, or you're drinking a lot of cold, it causes transmission, and that will cause blood clots, or you had an injury, that will cause blood clots as well, right? Then those are the cause of angina. Now today we're going to focus on since we know the cause of angina, what about the symptoms? We want to know the symptoms. Now most patients have the similar symptoms, okay? And one of the symptoms that is common happen is actually in the heart, in the chest area, right? Let's start a watch party in my Facebook. I have another platform, my personal Instagram. I'm going to put it on as well. Okay, let's go live. right? So our main topic today is about stable angina symptoms. What are the symptoms? Okay, we're going to talk about this today. It's mainly about pain, right? And the painful sensation that occurs during an episode of stable angina is often described as pressure or fullness. In Chinese called 胀闷, okay, pressure of fullness, okay, in the center of the chest, which is in here, right? It's over here. It's over here. Okay, let's go over here. It can cause go to the side, left side to the middle or to the left side, because heart's but toward to the left side. So the pain can feel like by squeezing on your chest, or like a heavy weight resting on your chest. And a lot of people say that, well, things that I have something that actually on top of my chest that I couldn't take it off. You know, someone stay on it. I have patients say that, well, someone like squeeze my heart, both hands. Someone like, if you squeeze yourself, it's that kind of feeling. Squeeze the heart so the heart can pump properly. So someone get pressure on the heart, or someone stay in a pushing in the heart. They keep over there. Hi, happy day. How are you? So this is the symptoms. The main symptom. More people feel that way. Okay, a lot of people get this way. So bear in mind, the pain from the chest is not just staying in the chest. Not just staying in the chest. The pain or the symptom, it can spread from your chest to your neck, to the arm, to the shoulder, some down to your fingers. Or it can come up to the jaw too. Face over here. In some patients, it's not, although the chest pain is the main one, right? But they may get the pain mainly in here or over here, shoulder pain. They don't feel much in here, and that is not the main complaint. The main complaint is actually in here, shoulder pain or neck pain. And they just have a different discomfort in there, and it's not annoying. More annoying probably in the shoulder or neck. It can be that. It can be that. Okay. Now, if during an episode of stable angina, you may also experience, if you suffer from it, shortness of breath. Not everyone, but yes, common. You can't breathe properly. Nausea. Well, nausea like a stomach problem, right? Yes, nausea. Like Wonder Woman. Fatigue. Why fatigue? Because you haven't got enough blood in your body. When you haven't got enough blood, you haven't got enough oxygen. Then if you haven't got enough oxygen, you feel tired. Simple. And if you haven't got enough blood pump up to your head, what's going to happen? Dizziness. Oh, not have enough blood into your brain, then it causes dizziness. It might feel imbalance when you walk. Oh, something like that. Then you may get sweaty. Sweaty with what? With cold. Sweaty with coldness. Why coldness? Coldness is because when you have not got enough, you haven't got enough blood circulated in your body and they become cold. So blood carry oxygen, nutrient to all the entire body as well as temperature. But without temperature, you gonna like without temperature, without blood flow, you won't have good temperature. More commonly, how do we describe this? I'm here to help you to understand. When you hold hands, shake hand for your friend, when you meet your friend and you shake the hand, oh, long time no see, wow, geez, you got cold hands. And they say, yes, I have bad circulation. You see, cold hands, bad circulation. Cold hand equal bad circulation. Bad circulation means not enough blood flow. Right? So simple. Very, very simple. So angina happen between having enough power in the heart to pump the blood through the body. So you get lack of circulation, and that cause feeling cold. Tend to more cold, especially the extremities. Hands and feet are colder. Okay. Anxious, anxiety, worry a lot. That is one of the main symptoms of angina. When it happens, they worry a lot. Because why? Because they have chest pain, and in Chinese medicine, when heart is actually supporting spleen and stomach. When heart supports spleen and stomach, heart is not supporting it well, and spleen and stomach get lack of energy and cause anxiety. So when it's angina, the heart can't support spleen and stomach, so spleen and stomach function are low. That's why it come up with nausea as well as anxiety. That we're using the Chinese medicine to understand all the symptoms. Now, we need to understand this. If you suffer from it, you probably know already, or if you're acupuncturist, a practitioner, you must know that stable angina usually happens after patients do exercise, overdo of the exercise. They do extreme exercise, and that happens because when you do extreme exercise, your heart need more blood circulation, but it hasn't got enough blood circulation to your heart, and that's why it causes angina. Now, the symptom of angina, we just mentioned all this. It tends to be temporary, lasting up to about 15 minutes in most cases. Some of them more shorter. So this is different from unstable angina, in which the pain can be continuous and more severe. So it's more dangerous in unstable angina. Stable angina not as severe and easy to pick up, and much easier to prevent, because when you get angry it happens, when you do exercise it happens, and then you can avoid those exercise, or you can try to manage your emotion better, so they can prevent it. For an unstable angina, is different. You can just sit there doing nothing or lay down, feeling relaxing, or watching um, a movie or listen to music, very relaxing, and it suddenly just happened. It suddenly just happened. It's more serious. And for angina patient, they always sign in there. They always sign in there. Even though you haven't got an episode, you may have cold hands and feet. More commonly, you have cold hands and feet. So warm up your cold hands and feet is important. Right? Or you may not have pain or puffiness all the time, but maybe all morning, every morning you have something in the chest, uncomfortable. But as the day go, it went because in the morning it's more cold. And one patient had angina every year, need to go to A&E, but she actually felt some pain in the heart, on the chest, every morning, every morning. But you won't put it as an episode because it's not bad to lead to that she need to go to hospital and she had like shortness of breath, nausea, fatigue, dizziness, sweaty, anxiety. None of that. It's just about pressure every morning. That's it. And as the day go, first thing in the morning, for a while, and then it went. First thing in the morning, a while, and then it went. Every day. Then once every year, and she need to go to hospital because it will had an episode. And she came here, it was in China. China happened every year, and came here, it happened as well. Extra time. Probably too much stress, I don't know. But I just want to let you know, there's always a sign when it happened in China before that. It's just you need to pick it up. Okay. And deal with those symptoms. If there's a symptom, means that angina is still there, and you need to take some action. And what is the action the best for you? We're gonna show you some acupressure point. Not on this. In the next couple of days, I'm going to show you some acupressure points that are very good for you to take care of the chest pain. I know with angina, most of you worry on medication, but you may still suffer from the symptom that we just mentioned. Okay. Now, the last thing is you can have an episode of stable angina at any time of the day. However, you are more likely to experience symptoms in the morning. Why is that? Again, because in the morning it's a bit cold, colder than the other. And when it's cold, the circulation slows down. So that is why more likely happen in the morning. Okay, according to the Chinese medicine, right? In the Western medicine, there is you won't put it that way to explain that to understand it. Okay, but this is in Chinese medicine. We talk about high calcium carabine from Scotland. Thank you for being here. So this is something that I want to share today with you. Right, stay awesome. And it's Monday today. I'm not working, but I have to train my new acupuncturist. So it's an extra day, and I'm going away for holiday for 5 days, and I'm not sure whether there is internet access. If there is no internet access in for my hotel because we go for snow, go to Snow Mountain. I'm not sure yet, but if there's internet access, because we're not using Wi-Fi, we're using all cable. If I'll be able to do the cable and I'll be able to keep the live video with you guys. If I can't do it, I have to skip the live video for about 5 or 6 months, right? That's it for today, and stay awesome, and I love you all. I'll see you tomorrow. Tomorrow we're going to talk about what are the risk factor of stable angina, which means what sort of people that would more likely to suffer from stable angina. See you next time. Stay awesome. Bye bye. Thank you, Veronica. Thank you. See you.